Hello, everyone. Thanks for joining us today for the next presentation in our series of webinar forums on managing stress. This is a joint production of the Department of Psychiatry, the University of Iowa Hospitals and Clinics COPE team, and the University of Iowa Employee Assistance Program. I'm your facilitator, Dr. Laura Fuller from the Department of Psychiatry. Before introducing today's presenter, I have important information to share about today's program. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. If you think you may have a medical emergency, call 911 or go to your nearest emergency room immediately. No provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees nor any contributor to this webinar makes any representations or warranties, express or implied, with respect to the information provided herein or to its use. So, now that I've said that, I want to tell you that we're delighted that you've joined us for today's program. If you're watching the live stream version, there will be time for a limited number of questions at the end. Please use the chat function to submit questions. A recording of this webinar and further resources will be available at the Loop on the hospital website. Our presenter today is Dr. Patricia Espe-Pfeifer. Dr. Espe-Pfeifer is a clinical professor in the Department of Psychiatry. She's involved in research and teaching as well as doing clinical work as a pediatric neuropsychologist and a therapist in our adolescent DBT program. The topic for today is emotion regulation skills for parents and teens. Back to the basics. During her presentation, Dr. Espe-Pfeifer will talk about managing and regulating emotions, which are skills that are described as extremely valuable by parents and teens who have participated in our department's DBT skills groups. Of course, these same skills and principles can work for all of us, whether or not we have teenage children. So to tell you more, without further ado, is Dr. Espe-Pfeifer.
Good afternoon. Thank you, Laura, for the introduction. I am so excited today to get to share with you some information about emotion regulation skills, getting back to the basics. As a psychologist within the Department of Psychiatry, one of my roles is as a dialectical behavior therapist. Within our outpatient DBT program, I am fortunate to work with teens and their parents in learning concepts and skills to practice and incorporate emotion regulation skills. Dr. Marcia Linehan, the founder and developer of DBT, along with Drs. Jill Rathis and Alec Miller, provided us with a useful framework about how to cope and manage stress, learn ways to manage anxiety and depression symptoms, and effectively navigate stressful times in our lives. If you had told me 6 months ago, or really even 2 months ago, that I would be giving this webinar on coping strategies during a global pandemic to help my UIHC colleagues, I would have looked at you with disbelief, probably chuckled or laughed out loud. Yet, here we all are. For many of us, the COVID-19 outbreak has made life different. Since mid-March, many aspects of our lives have changed. And it is fair to say that these changes have been stressful at times. Activities and planned trips were canceled. For me personally, my normal spring routine is filled with activities that I love and that bring me a lot of joy, such as track meets, club volleyball, local fundraisers, and end-of-the-year school activities for my kids. When these activities were postponed or canceled, it felt like a huge loss that came with a very huge mix of emotions. Social distancing has been a new concept to learn and one that does not come naturally for many of us. For example, trying to follow the one-way arrows at grocery stores. For me, resisting the urge to correct someone on the appropriate way to wear a mask when they're out in public. And I apologize for this. I can't help myself because we're all now required at UIHC to do these different learning modules where we're trained on how to do it the appropriate way. Many of us are trying to navigate this new reality of virtual classrooms and homeschooling while keeping our fingers crossed that the school and work Zoom meetings don't all happen at the same time. Changes in work environments, shifts, and job roles are happening at a quick pace, and the ability to keep up with the constant flow of emails is daunting. Needless to say, this has been stressful on so many levels. When I was asked to give this webinar, I thought this is the perfect time to talk about the basics. So today I'm going to do a brief introduction to emotion regulation skills and how these skills can be applied to our new normal. Mood symptoms such as anxiety and depression can thrive on the unknown. So how do we stay positive during these times? How can we keep some perspective in the midst of all the changes going on in our lives? For example, how can we focus on embracing these activities that have not been canceled? Like we have more family time. We have time to read a book that we've had on our shelves. We have time to reflect on past activities or perhaps future plans. And we've had time to slow down instead of constantly racing from one activity to the next. I'd like to introduce you to the ABC Please skills of reducing vulnerability to our emotion mind. Those are our thoughts when they are completely ruled by feelings. There's also our reasonable mind that's ruled primarily by facts and logic. And this can all be compared to using what we call our wise mind, which uses a good mixture of both reasoning and emotion. This is the wisdom within each of us that helps us to think through a situation and avoid acting impulsively. So I'm going to start with the ABC Please skills by starting with the please part. You can take care of your mind by taking care of your body by doing the following. These are all reminders to focus on self-care, especially during this time. These include treating physical illness, balancing your eating patterns, avoiding mood-altering substances, balancing sleep, and getting exercise. These 5 steps are foundational behaviors that can be helpful when balancing our mental and physical health. So if we look at treating physical illness, this means taking care of your personal health needs, which can be really tough when there are so many changes going on for healthcare providers and the patients that we serve. However, it is really important that we take the time to take care of our own physical needs. If we have pre-existing conditions, we need to make sure that we're on top of those and still communicating with our healthcare providers if needed. We also look at balancing our eating patterns. Being at home and less active makes it really easy to graze and not be mindful of how often we may be visiting the kitchen. Try not to eat too much or too little, and stay away from those foods that you know make you overly emotional or irritable. That could be too much sugar. For me, that's too much caffeine. Avoid mood-altering drugs. Excuse me. Balance your sleep. And this is a really important one. We need to try to stick to a schedule and get the amount of sleep that works for you. And getting exercise. This is a perfect time to try that workout or get back into an exercise routine, as there are numerous places offering virtual workouts. So you have the opportunity to start small and build on it as the days and perhaps weeks go by. So now I'd like to focus on the ABCs. In DBT, a way to reduce vulnerability to overwhelming emotions is to use our ABC skills. A stands for accumulate positive emotions by doing things that are possible in the here and now, that are pleasant and still bring you joy. B is for building mastery by engaging in activities that make you feel competent, confident, and that can help combat any feelings of helplessness and frustration that you might be feeling. And the C stands for coping ahead of time with emotional situations. So if we focus on the accumulate positive emotions, how do we do this? How do we accumulate positive emotions, especially when we feel like there are so many things that we can't do given the current situation? One thing is we can start by building positive experiences now. This may be by increasing pleasant activities that lead to positive emotions, do one thing each day that brings you joy, and be mindful of positive experiences, which can be challenging when anxiety and stress levels are high. We're going to come back to how to build those positive emotions in a moment. Now, when we look at building mastery, this is that part of where you're engaging in activities that make you feel confident and competent in what you can do. So what I challenge you to do is try to find at least one thing each day that makes you feel confident. For example, for myself, I find that putting goals on paper, discussing with a friend or family member helps me stay on task, and I'm going to be more responsible about working on that goal that I set. I also make it a point to do something that is challenging now and still possible for me to master. Then I can gradually build on this as the days and weeks go by. Now, when we look at coping ahead, this is where you can devise a plan of action by describing a situation that's likely to create negative emotions. Decide how to problem solve that situation. Imagine the situation in the here and now. And you can rehearse different effective coping strategies in your mind, or even write those out. For example, if we look at coming up with a plan, if you know that you have children have their school meetings at a certain time of the day, you're trying to navigate your own Zoom meetings or own work outside the home, then trying to come up with an effective plan to try to get all those things done so that everyone is on board, and trying to figure out a way that can make it the least stressful situation for all of your family members involved. So now we're going to circle back to how do we create activities that bring us joy. Now, in the DBT groups that I do with teens and their parents, we oftentimes look at what are some pleasant activities that we can do just in general. And these can be a broad range of activities like listening to music, going to the mall, things like that. However, now there are a few hurdles in the way due to social distancing and places being closed. So what we can do is adapt what some of those pleasant activities are. And this is a really good opportunity for us to figure out things that maybe we didn't know brought us joy, or things we didn't know were fun activities because we didn't have the time to do them. So pleasant activities now could be still listening to music. Now that we no longer have snow, cross our fingers that we don't get any more this season, we could go outside and lie in the sun with sunscreen on just for a few moments to soak in some rays, feel nature around us, and just get out of the house. We can engage in reading, maybe pick up drawing or painting, working out. You could make a gift for someone, take up cooking or baking, look at old photos that you have, or take the time to look at photos that you have on your phone. You can make a smoothie, a cup of tea or coffee, and take the time to drink it slowly and do it mindfully. You can also take the time to rearrange your room or rearrange one of the family living spaces. And you can give yourself kind of a home spa day. We all know that we need those these days. Other individual activities that teens particularly may find pleasant would be you could FaceTime someone you haven't spoken to recently, start a round of 20 questions with friends over text, join a live stream exercise class, host a Netflix party with your friends where you can watch something at the same time and chat while you're doing it. You can even create a dream board where you find images that represent what you want your life to look like 1 year down the road, 2 years down the road, and use those to create a collage to put up in your room. You can also take a free class online through Coursera or Skillshare. Now, there are also a number of parent-teen shared activities lists. And it doesn't have to be just parent-teen shared activities, since we are often in social isolation with our entire family. What we can do is set this type of activities list up and make it something that everyone in the family can participate in their own way. So some family shared activities could be plan a virtual game night, host a family round of Top Chef or Chopped. This could be one where individuals in your family each make their own kind of dish or dessert, and then you all vote on which one you like the best. You could pitch an idea for a vacation in the future and choose a winner. For this, each family member could write down activities or the places they'd like to go and why, including where they'd want to stay, what type of fun activities they'd like to engage in at that vacation site. You can also take the time to go outside, plant a small garden, go for a family bike ride, make family walks something that you do, especially if you have a dog, family pets that you need to be walking. Do that as a family. Make it a fun activity. Another example of a fun family activity is giving your family a hug, not in person, but emotionally. Now, what this means, and this is actually from one of my high school classmates and friends, Ty Tonander, who is the vice president of brand design at Ultra Creative in Minnesota. And he recently published an article that had that exact same title. And in it, he wrote a really heartfelt post on what it means to still try to stay connected to your family members that are not in the house with you. Those that may be in another state, in another town, those that for whatever reason it may be, you're not able to be in immediate contact with physically. And what I loved about Ty's article was that it was just so positive. And he also really had some wonderful ideas about how do we stay emotionally connected. I'm going to read you one excerpt from it. To me, baking and cooking is a tradition that my grandmother passed down, my mother passed down, and now I'm passing down to my kids. But it's not just the cooking or the baking. It's sharing these traditions with my own daughters to make sure that these recipes continue on in the family. So Ty's idea was to go about and take this time with his family and pass down some beloved recipes that have been passed down throughout his generations of his family, and to take the time and to talk about the memories of his family members and pass that down to his daughters. And I really thought this was a neat idea and one that has so much meaning and something that might bring you great joy down the road when we look back at this time and think about what were some of the positives that came out of it. So I hope that you can take some of this information that I presented today and incorporate it into your day-to-day functioning. Find some things that bring you positivity. Find things that bring you joy in your now day-to-day activities. This doesn't invalidate the stress that we're all going through right now. And it really does drive home the idea that this is a time that we need to build community feeling, build ties with our family, things that we can look back and think, I really did have a positive experience despite the level of stress that was involved. And those are the types of things that we really need right now. So I wanted to share one last thing, and it's from a site called Whispers of the Soul. It says, "We are all in the same storm, riding crazy waves, but we are not all in the same boat. Show kindness and help where you can. We are all navigating very different journeys." I hope that you can take this and use it in your day-to-day functioning and find some positivity from it. Thank you.
Thank you, Dr. Espe-Pfeifer. That was very helpful to hear some ideas for parents and teens in navigating this difficult time. And I personally felt like these things would be very relevant for all kinds of people, whether or not there are teens in the house. There are a few questions. One thing that came up a lot in the please skills that you were discussing at the beginning, the word balance came up a lot. Can you talk more about how balance is part of the DBT framework and how balance can help us in regulating our emotions?
That's a really good question. I think for all of us, balance is going to be what can you do that allows you to, get the sleep that you need, get the type of food that you need, but do it all in moderation. Do it with knowing what works for you. This is definitely a time in our lives where we need to use the skills of doing what works. And if you know something works for you, trying to focus on that balance part. It's okay if you are trying to have a healthy diet and still having that treat that you earned through the day or that you thought would be really good. Sometimes we need to have those things in place and just do it in moderation.
All right, that's very helpful to know. Another question is about the idea of coping ahead of time. You mentioned that as part of the ABCs, and I definitely noticed that things go better when I cope ahead of time. We don't always have the chance to, but I was thinking about how that requires a lot of thinking ahead, but it also may involve like asking for help. Can you talk a little bit about what ways work best for coping ahead of time, or maybe give a few examples of how somebody might cope ahead of time?
So I know from my own personal experience, having 3 kids at home, my husband and I are both working, whether it's at home or at our clinics. It takes a lot of balance and a lot of planning ahead to figure out what's going to work. In the midst of all of this, I'm very fortunate in that we adopted a new puppy from a local rescue that I just adore. And it's a lot of work. So even for today's presentation, I had to kind of plan ahead, make a plan of attack of how could I keep both of our dogs quiet since I'm here in our living room space? How can I do this webinar without having those interruptions? while also planning ahead and knowing what my kids' schedules are for the day and their expectations for their schoolwork. And so what I find really helpful now is just planning out a schedule for myself and for our kids. And with all the information coming in, that often has to change on a day-to-day basis. I have a lot of Post-it notes up. I have a lot of things written down on paper that I try to adjust as changes come about. But I think that coping ahead really also looks at if you know you're getting overwhelmed by certain activities or things that you now have to do on a day-to-day basis. What can you do to reduce your vulnerability to getting stressed out? That could be making sure you're getting good sleep, going to bed at a regular time, getting up at a regular time, making sure that you're eating at normal intervals so that you're fueling your body and your mind, and making sure that you're also taking time for self-care throughout the day.
Thank you. You mentioned wise mind. You mentioned the wisdom within each of us. How do people know when they're functioning in their wise mind as opposed to their emotion mind or their rational mind?
It can be hard. I think oftentimes we disregard when we've made good choices, and we often focus on what we did wrong, things that are stressful. And so a lot of wise mind is thinking about, did I look at the situation? Did I think about what were some choices of how I could approach the situation? And what are the feelings that I'm having about it? So wise mind isn't about getting rid of all emotion, and it's not about making choices based only on the facts. It's about taking both of them and making the best decision for yourself for that situation. So I find for myself that we often don't recognize, especially when we're stressed, when we are making wise decisions.
Right. Thank you. I wanted to express appreciation for the message on your shirt. Now that we're both in the screen, I can see the whole message of "We Stand Together," which is awesome and very true. That is the end of the questions, and I wanted to say a couple things here at the end. Thank you, Dr. Espe-Pfeifer. We appreciate you sharing some practical steps that we can take to respond to the coronavirus and being cooped up together. A recording of today's live stream, as well as links to additional resources related to emotion regulation, will be included on the loop later today. Next time, we'll be joined by Dr. Jamie Elizalde, who will be discussing family resilience. Until then, take care, and we look forward to seeing you soon.
Thank you, Dr. Fuller.